My name is Michael Sirkin. I'm an orthopedic traumatologist in North Jersey. I work in Newark University Hospital, which is also affiliated with Rutgers, New Jersey Medical School, where I'm a professor in the Department of Orthopedics. I have done some research and work with pilon, tibial plafond fractures, and then my other specialty would be in orthopedic infections. All the other systems, all the external fixator systems out there, the clamps are usually all or none. And so what I mean by that is they're loose or they're tight. And you can't titrate your reduction. You have to pull, tighten it. If it's not right, loosen the clamp, move the position, and then tighten it again. When I'm using the seal frame, I can take, through a worm mechanism, I can just have things slide over nice and slowly, slide it over, take a fluoro. It's not quite where I want it, keep going, and then it gets in position, and I don't have to lose what I've already gotten. So I can correct one plane at one time, as opposed to having to hold all the other planes and correcting that one plane. The learning curves are really based on little tips and tricks and nuances of the clamps. It's not really learning a new system. It's the same pin bar frame that any other frame is. It has a way to attach a pin to a clamp and a bar to a clamp and the pin to the bone. That's identical. It's just, as you use any clamp, there's little nuances. How do you hold the clamp? How do you hold the wrench? How do you hold the screwdriver to be able to tighten the clamps or put the clamps in better positions? And you learn that with any new system you do. But in terms of what it's capable of doing and what you do, it's exactly the same in that respect. The only difference is now you can do some fine-tuning through the frame itself. So when I'm teaching at courses, I try to do two things. I think a lot of people, so I want everybody to get a little bit of a benefit. Obviously, the manufacturer and the sales consultants, they get the benefit of me showing somebody a new product and that has some more capabilities. The participants, I really want to get more than just that. They get the benefit of seeing a new product, learning some new capabilities that maybe the product doesn't have or an advantage, but I also try to give them some general orthopedic knowledge or general orthopedic education through my 25 years of experience doing orthopedic trauma, and I try to teach to that as well. So I try to not just teach to the product, I also try to teach to principles and avoiding complications. The reason to change or the reason to switch and try something different is to just see if it offers an advantage in your hands to try a different frame. So I would tell the person who hasn't tried a seal, give the seal a try, see if you can like the ability to have fine adjustments in a couple different planes and see if it offers any benefit to you in your practice. And if it does, then consider trying to use it. And if it doesn't and you're comfortable with what you like, then, you know, do what works in your hands. I think the most important thing in orthopedic and in any surgical field is find something that works for you and do it. Investigate and try new things that may work better, and then always reevaluate how those things are going for you and whether they're working or not for you.